Hello and welcome to Gulf Coast VA Today, an informational show about what's happening in the Gulf Coast Veterans Healthcare System. Each month, we cover news, services, and programs in our healthcare system relevant to you, the veteran. I am your host, Vernon Stewart, Chief of Community and Public Affairs and Marine Corps veteran. Today, I have with me Marthena Moffitt, Minority Veterans Program Coordinator. Marthena, welcome. Tell us a little bit about yourself.
Thank you. As you said, my name is Marthena Moffitt. I've been with the VA here at Gulf Coast Veterans Healthcare System in Biloxi for a little over 20 years. Currently, I am the Assistant Chief of Pathology and Laboratory Medicine Service. In a collateral duty, I am the Minority Veterans Program Coordinator for here in Biloxi and also for our outpatient clinics.
Nice. So, Minority Veterans Program Coordinator. Tell us, what exactly is that? What's the program about?
The Minority Veterans Program is concerned about minority veterans. It was viewed probably about 20 years ago that minority veterans weren't being informed of the different benefits that they had. And in that minority category, that included Native Americans, African Americans, Asian Americans, Alaskan Native, and Native Hawaiian Americans. So what this program did was to be able to inform those minorities about the different benefits that they are entitled to as veterans. Some of those benefits would include cemetery and burial benefits, educational benefits, home loans, and also compensation and pension benefits. We also are able to inform spouses of the different benefits that their spousal veterans may have. So what we do is we go out to different colleges, community events. We have partnerships with veteran centers so that we can make sure that we have outreach activities to reach these veterans that may not have been informed of such activities that they're actually entitled to.
Yeah, this sounds like a very important program and service. With us trying to be a more inclusive society, we definitely do not want to leave out our minority veterans and their families. So so I agree with the significant importance of this program. So with everything that's happening in our current society with the pandemic, it's kind of hard with everything as far as social distancing goes. So we're not able to do as much outreach as we want to. So how are we coping and adapting to this new type of environment where we can't physically be at certain events and activities?
For right now, what we're doing is I'm doing different newsletters out to the different churches in the different areas. Those areas to include Biloxi, Mobile, Alabama, also in Florida, in Pensacola, Eglin, Panama City, and the surrounding areas. I try and reach out to different ministries. When I also try and do outreach activities, things are now virtual, as in this interview today. So I will explain the program at different virtual meetings and virtual events that they have. Also included in the Minority Veterans Program are women. Probably 20 years when I started here, I didn't see very many women veterans actually coming in and actually having services here. So what we do also is inform those women veterans that they can come to the VA and actually have their medical health care done here, even if they're pregnant. Sometimes a lot of women veterans don't know that they can actually come here to the VA and have their prenatal care done. And as they get closer to having their infant, we can actually farm them out to a Department of Defense hospital, and then they can have their They can have their infant there and then come back to the VA and still have care as a woman veteran.
Wow, that's huge. And I'm sure a lot of women veterans are not aware of something like that. So that's part of the reason why we are trying to do things like this, is try to get the word out, and with the outreach activities that you are involved in are doing, extremely important. So if someone that's watching, for those veterans and family and friends that are watching right now, what can they do? Where can they go if they want more information or if they want to help support this program?
I have some pamphlets that I actually leave at the different vet centers. So at the vet center in Pensacola, in Mobile, and actually here in Biloxi, I try and make sure that I have a pamphlet there which has information on how they can access the benefits, and also my name and information, so that if they need to personally contact me, they can, so I can try and assist them, or at least put them on the right path to get whatever benefit that they're trying to obtain. We're actually putting also advertisements out on Facebook, on Twitter, on social media, so that they know.
Absolutely. Yeah, very, very great information. Very accessible, it sounds like. So let me ask you, if you are you a veteran? If not, what is your tie to the veterans in general?
Unfortunately, I'm not a veteran, but I am married to an Army veteran. He served our country for 20 years. My father was an Army veteran as well. He served our country for 20 years as well. And I have an older brother. He only served 5 years, but he was in the Army as well.
Oh, wow. Wow. You have a lot of ties to veterans, that's for sure. And make sure you tell them thank you for their service and for your family's service as well. So let me ask you, is there anything else that you would like the public to know about your program? Any other assistance that you all can provide as far as the public goes? This is your opportunity to share anything else that you would like about your program.
I think basically I've covered pretty much everything that the program can offer, but people that are actually seeing this program, I want them to know that they can actually call the VA here and get in contact with me. If they know of somebody out there in the community that needs assistance, let them know to call the VA, ask for me. And what we can do is actually get them in contact with the benefits that they so rightly deserve as a veteran. Sometimes people just say, well, I'm a veteran and I already know, but you may have a friend that may not have known what they have available to them. Some of them served 4 years and they're just out in the community. And now more than ever, this could be the information. They may be the tool in order to get their friend the health care that they need.
Absolutely. Inclusivity, leveling the playing field, it doesn't get any more significant than that. Marthena Moffitt, Minority Veterans Program Coordinator, thank you for joining us today.
Thank you very much.
Thanks for joining us on this episode of Gulf Coast VA Today. Make sure to follow us on Facebook and Instagram at VA Gulf Coast, and visit our website at www.biloxi.va.gov, where you can subscribe to our email list so you are always in the know. Also be sure to tune in for our next episode. But until then, soldiers, sailors, airmen, Coast Guardsmen, Marines, family and friends, thank you for your service and support. Semper Fidelis.